of our residents is now more important than ever before. Yet we still don't have enough staff to do so effectively. And this in turn is creating additional stress and emotional unease on our staff. I know that this is a shared experience with many of my colleagues, but I personally have struggled a lot mentally while working through the pandemic. It has been exhausting and emotionally draining. As a frontline worker, we've been stretched beyond our limits. We've been the sole social interaction for and support for our residents and for many months. While we're so time poor, we have had to find extra time to provide additional emotional and mental support. We've had to find extra time to explain to a confused resident again and again. Their family want to be there for them, but they just can't. We've had to find extra time to spend longer talking on the phone, reassuring family members that their loved ones are okay. We've had to find extra time to comfort palliative patients while their family just couldn't be there due to COVID restrictions. Yet we have not been given more time, and we certainly haven't been given more staff. So we continue to stretch beyond our limits to provide the care that our residents deserve. Some situations I've struggled with most during this year have been the lack of support for our mental health. We've been forced to enforce harsh COVID restrictions, and we've had to watch our residents cry for their families. We've had to watch family members grieve from afar the death of a loved one, and we've had to watch the mental toll it's taken on our colleagues. I've struggled because I feel like I'm putting everything into my job and to care for these people, but you're left feeling like you're not doing a good job, like you're not providing the best care, and you're not giving your residents what they deserve. It's hard to continually remind ourselves that this isn't a fault of our own, but a fault of our government. Yet we are the ones who are faced with the effects of our broken aged care system. We're the ones who watch our residents cry and listen to our residents wish for more staff, because even they aren't blind to the issues. With the COVID restrictions, I found that the requirements of my job have grown. My responsibility as a registered nurse has increased, and my workload has significantly increased. Yet my shift is still the same size, and we're still drastically understaffed. Working through the pandemic has personally pushed me to my absolute limit. It's pushed me to the point of stress and mental fatigue that I've never felt before. I remain passionate for aged care and passionate to see change. Yet I have become very unsure whether I could continue to work in the sector, because if we don't see immediate change, then many staff, including myself, will continue to work until a point where we can no longer mentally or physically hold the system together. Because at the end of the day, the staff are the only thing that are holding our aged care system together. And we're struggling and our residents are suffering. My greatest concern is our government operates aged care with a profit before people mentality, and this is the exact opposite of a caring economy. Profit before people is evident in the fact that we're dangerously understaffed and we don't have the access nor the support that we deserve. Aged care staff work tirelessly around the nation without the appropriate support or compensation from our government. Not to mention, our aged care facilities are filled with people who have served our country for years, and they've fought for the life that we are fortunate enough to live. But we can't even spare the time to listen to their stories. And that is exactly why our aged care system is broken. Although despite all of the negativity that's been broadcasted this year, and especially in the aged care sector, it's important to recognise the overwhelming number of positive stories. Through this time, I've been left in a state of awe and amazement at the incredible care workers, nurses, domestic staff, and all the other supporting staff that work in aged care. During this difficult time, we've stood together in solidarity and we've come together to look after each other like never before. I'm extremely blessed to work with an incredible group of people, and it would not be possible without the people that we have by our sides to look after the residents we all love. We will continue to fight to see better conditions and conditions that we want to provide the quality of care that our residents deserve. Thank you.
Thank you so much, sister, for sharing those stories, the struggles, and also the inspiring moments during those times and these trying times, and for us to continue our sharing of experiences from different healthcare workers and care workers in the Asia Pacific, I'll turn you over to Sister Ina Duran.
Okay, good afternoon. I'm Ina from Indonesia. I apologize if my English is not good. Okay, I'm working in Carolus Hospital to 25 years as a nurse. In the union, I have the responsibility as secretary. Okay, as we know, COVID-19 is really a monster for us. Came without prior notice and then destroys our social life. COVID-19 brought us into a life of anxiety, disruption, and sadness. Even though this pandemic is actually can be used to look back into our behavior, how we lived our life before this pandemic came. And from there, we then realize how unprepared we are for this pandemic. We all know that COVID-19 is not only affect to health problem, let's say hospital or clinics, but is also a problem for other sectors of our lives. So stay home and lockdown is the best way to deal with COVID-19. But at the other side, other problems occur related to our economic conditions, education, healthcare, and so on. This reflects that actually our life system is not ready or well prepared. As a health worker, I do care for my patient's health condition. In the same time, I do care my co-workers' health as well as my own health, because we are the health workers which is working in the front line of health battle. We have to make sure that we are in a good health condition before we take care for the patient and take the risk of virus transmission. I think other sectors have the same attention as well, like school teachers, workers in public office, and so on. But for me, this pandemic can also be considered is a creative time, I mean a new creation. We need to be more creative to live in a new life system. Do not just be expert on science, but we need to stay together and share our ideas to deal with this situation for the better life system. Based on the previous background, I and other union leaders work hand in hand to make the better life system possible. The first, in the scope of local level, union works hand in hand with hospital management and supervise the submission of beneficiary data to government, social security, the data of workers whose income is below 5 million rupiah to receive the cash assistance from government in amount of 600,000 rupiah per month. And the second, when government provides an incentive allowance for health workers to doctor and nurse, we felt that it was a bit discrimination, because in a hospital, doctors and nurses are working together with other professions, medic and non-medic. So if you say health workers, it means hospital workers. As a whole, there are doctors, nurse, radiographer, analyst, laboratory workers, and even administration staff, security, cleaning service, and so on. Since government only provides the allowance for doctors and nurses, then we take action by sharing. We collect an amount to share with them. And the third, union visits the member and give a packet of food, a vitamin, and mask. And the fourth, in the national level, federation, union send a packet of hazmat suit, hand sanitizer, a vitamin, honey, mask, and face shield to help workers or members in the union in some provinces or hospital where our members are located. I think this is my sharing and experience during this pandemic. Thank you.
Thank you so much, sister, and thank you for everyone who's in here in the Zoom room, sending the loves and support and appreciation to our care workers today. If you have concerns and questions, please feel free to put it in the Q&A button, and you can also use hashtag Care Day 20 and invest in care and equality now in our social media pages. If you can do both while listening to us and doing the tweeting and posting the messages of our forum for today, but not just for today. As we go along with the campaign on Invest in Care. I really have this similarity of situation to Sister Ina. Of course, we are in the Philippines. We are both in the Southeast Asian region. And so to follow that story, and I think it's very connected to each other, we have Brother Aristotle Francis Sanchez of AFW Centro. Brother Francis.
Hi, good day to all. To be in the front line during the pandemic is really an extra challenge. Uh, Physically, emotionally, and mentally. Physically, because some of us need to walk 4 to 7 kilometers just to be in the pickup area of our company provided shuttle service that time during lockdown, because during lockdown there's no transport service, so our company provided shuttle service, but on on a strategic area only. So most of us need to walk few kilometers just to go to the pickup area. Then some of us also need to use their bicycle as their means of transportation. Also, uh, to those assigned in isolation areas, normally they render 12 hours without eating and peeing, because it is inconvenient on their part to don and undone their PPEs. So they opted to finish their duty before they can eat and pee. And emotionally, because some of us stayed on accommodation rooms provided by the company during the pandemic and leaving our families for the meantime. Some of us who decided not to stay on accommodation room, risking our family members to be exposed also to COVID-19. And there are instances that some of us who got infected by COVID-19 infected also their family members, because government and World Health Organization promotes home quarantine to those asymptomatic patient. So there's a risk also if uh, asymptomatic patient uh, stays in home instead in hospital environment. We have also co-workers and doctors died due to COVID-19. And mentally, it also affects all of us because of the situation I mentioned earlier. Some of us tender their resignation because of fear, anxiety. Some even didn't show up, no, absent without official leave. The sad reality is the government, public, all praises to us all healthcare workers. They say heroes without cape, but does not really give what due to us, which is fair compensation. And also, the government passed the Bayanihan Act, but it focus only to those healthcare workers in the government. And if I have only one wish, I wi- I think it is I wish this COVID-19 will totally disappear in the whole world so that we can back to our normal life, and hopefully even without COVID-19 our government will truly value us healthcare workers, not in words or praise, but in meaningful law or act for all healthcare workers in government and in private. Thank you.
Thank you so much for your insights, Brother Francis. And he is just one of the testimony of what's happening in our country right now. So it's not just like what I've said earlier. This crisis. It's not just about investing in a public healthcare system, but really investing in the lives of those workers who are sacrificing their lives for every one of us. And for us to continue the story, let's hear Sister Marian Bishop.
Hello, everyone. Um, a lot of our in New Zealand, a lot of our deaths happened in residential aged care, and that was really, really hard when you worked in residential aged care because you were always concerned whether that would get into your facility. Obviously, a lot of people had fears. A lot of staff had fears of getting COVID while working, of taking it home to their loved ones, taking it home to their friends, and also bringing it in from the community into the facility and the residents getting sick. So they had that fear. While doing that, they did the best they could to not mix with people outside and things like that to minimize getting COVID themselves. And we were reduced to lots of aged care workers here work in more than one facility. And of course, you couldn't do that. You really had to limit only working in one facility. So you weren't taking it from one facility to another. So that also gave those people extra financial pressure. Some staff weren't allowed to work if they had immune compromised conditions or if they were over 65. And if they were exposed to anybody that had COVID or they had any COVID symptoms themselves, they weren't allowed to come to work. Some facilities actually took people's temperature as they came on duty, and if they had a temperature, it was considered a symptom and they weren't allowed to work. So this affected people's incomes because not all facilities applied for government assistance. So it meant staff had to use their annual leave, their sick leave, their days in lieu and things like that, which put them under a lot of financial pressure again. So I hear other people saying, you know, that mental stress that put you under, financial stress really causes more mental stress. The worst problem was people didn't have PPE gear, and staff weren't encouraged to wear PPE gear because it didn't need to be worn unless a resident had symptoms, etc. So that was another fear of getting COVID. and the union and workers fought really hard to get it recognised that people really needed to wear PPE gear, etc. And then there wasn't, of course, the supply of PPE. I don't think we were really, I've heard somebody else say, we didn't really feel prepared for it. You know, we might have thought we were prepared, but I don't think we were really prepared like we should have been. Residential aged care got locked down quickly, mainly because of the deaths. And as Emma has said, we were locked down for a long time. And that was really, really hard on the residents because people weren't allowed in, they weren't allowed out. And Zoom calls and phone calls are all well and good, but it's not the same as having a hug from your daughter or your son or your grandchildren. It's not the same. So it did put staff under a lot more pressure. And when you're already struggling to meet your workload, more pressure like that isn't something you need. But because we come from a caring environment, we do it willingly, and staff always tend to go without their own breaks to make sure residents get the needs that they need to try and get their workload done and feel like they're doing the right thing. And of course, residents getting sick is really hard, as Emma has said also, and putting on PPE gear when they're sick, because you were allowed to wear it when they were sick, and caring for the resident and then having to take it off and then go to and wash your hands and then go to another resident and everything. There just didn't seem to be the thought that you needed to wear masks because you didn't need to wear it. If you wash your hands, that's enough infection control and things like that. I don't think that was good enough. And the one thing that came out of it was staff being really supportive to each other, because we knew we were in this together and we had to get through it. And them sharing ideas of what they have done in the facility and outside the facility to keep themselves safe and their families safe and everything, and having that camaraderie just to get you through it, which was really good. And there were residents that appreciated it, but it was really, really hard on everyone. And I think it brought the residents and the staff closer together, to be quite honest, because you developed more of a bond, because you were their only contact, really, their only live contact that wasn't via Zoom or phone. So it did have some good things. Staff felt because they were doing such a risky job and they were risking their own safety and the safety of their family, that they should have been paid more. And some staff tried to get paid more and did get paid more, so they felt more appreciated. Some got paid more per hour, some got paid a bit more at the end of the time, but it was mainly during the lockdown time. So yeah, it was difficult for everyone, but we're getting through it, pulling together. Thank you.
Thank you so much, Sister Marian. It's very good to hear and that realization that even in OECD countries here in Asia Pacific, workers are experiencing almost the same stories that we have heard a while ago. The anxiety, the stress, not just mentally, emotionally, but also financially, because I can imagine how many leaves that the workers should be given. During this time, especially that quarantine leaves is not yet legislated, so there are really lots of challenges, but hearing that workers are supporting each other, that's really the spirit of unions, and that's really the spirit of solidarity. Thank you so much for that reflection, Sister Marian. And now we move on to our sister from the South Asian region, Sister Anne Joseph.
Morning, everybody. This is San Joseph from India. Good morning, everybody. This is Ann Joseph from India. I represent Telangana Domestic Workers Union, and it was wrongly mentioned that Telangana State Domestic Workers Union. It's not Telangana State, it's the Telangana Domestic Workers Union. It is affiliated to CFTUI, Confederation of Free Trade Union India. I was working in this union for the past 20 years as a trust member. This COVID time, the pandemic has reminded everyone the value of the work. Every employee, whether it is a daily wages laborers, whether it is a factory workers or domestic workers, faced many challenges. Domestic workers were not allowed to work for 45 years. They were asked to do the COVID test and bring NOC certificate. They were asked whether they are COVID negative. They were asked only you should work in only one house, not in the other houses, so that they won't spread the COVID to them. They have most of them lost their jobs and returned to their hometown without proper transport, medical facilities. Most of them left their lives. People who were not able to pay their rent were left homeless. Children's education has stopped due to parents could not afford them to buy a smartphone to avail the online classes. COVID has turned them so much of worries. Finally, when people started adopting the normal norm bombs, their hopes were shattered by recent floods in Hyderabad. So most of them uh, uh, lost their homes, belonging, and basic needs. After long time of fighting of the domestic workers, doing protest under the government of the officers and visiting government officers, doing protest, doing million march, finally we were identified as a unorganized workers, but we couldn't get any welfare schemes or uh, welfare included in the welfare board. So finally, we wanted that domestic workers should be identified as a worker, but they should avail all the welfare schemes to them, that they should get ESI, PF, social security for the rent, and welfare schemes for domestic workers.
Sister Anne?
Yeah.
Yeah, you're done?
The problems
Thank you.
faced in domestic the problems faced by domestic workers is very much in their workplace and their houses, and from the government also, we would like the government to identify them and give them the rights for the domestic workers.
Thank you so much, Sister Anne. I think in our forum this morning, afternoon, or evening, it's very important that we are also hearing the voice of the domestic workers, because they are also facing very difficult challenges in different levels of hardships from their workplace uh, up to the level of repatriation challenges because of losing work. But like what Sister Anne have said, it's very important that the government should really recognize that domestic work is work, because there will be no productive work after all if there is no reproductive work. So all productive work are from the reproductive work. So thank you so much for sharing the voices of our domestic workers, sister Anne. So I also feel her in a sense that, of course, many of the domestic workers are women, and now it's almost the start of the school year, and there are difficulties in the education system, and most of them are parents as well. So not everyone have the access to a quality education, and even to the basic requirement of having gadgets like laptops and internet. Connection. So it's issues are now interlinked with each other, and we should took note that education in itself is part of the care economy as well. So as we move on, it is very good that our sister from the International Labor Organization, she is a gender specialist and of the ILO Decent Work Technical Support Team for South Asia, and she's based in New Delhi. Our Sister Aya Matsura. So, Sister Aya, I think it would be good that after the sharing of experiences and hearing their stories, it would be good if you could walk us through the key findings and recommendation of the care work and care jobs for the future of decent work report. Thank you, Sister.
Thank you. Thank you, Nice. I have shared the PowerPoint. Would you be uploading it, please? Thank you. So first of all, thank you for having me for this important forum. Really hearing all your stories indicates the importance of working on care economy, investing more on care economy. So I've been asked to share kind of the summary from the report in 2018. So the report is, obviously from 2018, so it does not have anything on COVID-19, but obviously the topic is ever more pertinent in the current times. So I would like to share some information from the report, and I hope you will find some information useful for your advocacy efforts to really promote decent work for all care workers. But first of all, I would like to also express my sincere respect to all workers in the care economy, particularly those in the health sector, domestic work sector, for their tireless efforts to respond and to tackle various challenges brought by the COVID-19 pandemic. So even before the COVID-19 pandemic, we knew that the global transformation have been affecting supply and demand of care work. So aging population, we hear from many countries, obviously require many more workers in the care economy in the elderly care sector. Also climate change affecting people moving to different places located. You can keep the first slide, sorry. Yeah. Also family changes in family structure, etc. But of course, with the COVID-19, the demand for care increased tremendously in terms of both unpaid and paid care work. So this report in short shows that care work is at the core of a future of decent work and calls for investment in the care economy in terms of providing good quality care, ensuring decent work for care workers, and also financing the expansion of care services. So let's go to the next slide. So as you can see from this slide, when we talk about care work, of course, it has unpaid care work, there is paid care work, and there is also paid work that are all interrelated. Of course, unpaid care work, as Nice introduced at the beginning, mostly women do a lot of unpaid care work in the world, especially in Asia. I think men spend the least amount of time on unpaid care work. And of course, the amount spent on unpaid care work, whether looking after children or elderly members in the household, or for some people where they don't have basic facilities, they may have to go fetch water, firewood, etc. These responsibilities obviously take time and limit women's opportunity to participate in paid work. And because this work, unpaid work, is not recognized as work, this also has a kind of effect to paid care work, where paid care work is also not valued adequately, because care work is assumed to be kind of extension of work naturally done by women as part of a woman's responsibility. So that is also generally undervalued and low paid in many of the paid care work. But when we have investment in paid care work, that will have better impacts in terms of paid work opportunities for women, because they can participate in paid work while managing also care responsibilities, reduce care responsibilities. And then also paid care work this would be the area where employment can be generated. So when we work on care economy, we really need to address all of these areas to promote, realize decent work for care workers, and also to realize gender equality. So of course, we need to advocate for paid care work by advocating for financing, commitment and financing for paid care work. But also through organizations, through your work, we also need to promote better policies or measures that support reduce unpaid care responsibilities, or that will help manage care responsibilities, whether flexible working, sick leave, maternity leave, not only maternity leave, but also parental leave, paternity leave, etc. Okay, let's go to the next link, next page. I think this one was mentioned by Nice, but this basically shows the time spent daily in unpaid care work and also paid work, and total work by sex, region, and income group. So basically it shows that women spend more time working if they combine both unpaid care work and paid work. And really the time spent by women on unpaid care work is really huge, that affects women in the world of work. Okay, next slide. I thought this slide would be useful for your advocacy efforts to invest more in the care economy, because this shows that there is a positive correlations in terms of women's employment, and then also GDP invested in public care services. So if countries invest more in public care services, that means countries have better women's labor force participation rate. I think with COVID-19, many countries are very concerned about economic crisis as well. And also many people have lost their jobs. And the countries will need to work on also creating jobs. So this will be the place where countries can invest and focus on employment generation. And that will also help create a better normal where care workers are also cared, and there is a adequate number of care workers. Okay, next slide, please. So just to review decent work for workers in the care economy, we are obviously talking about the same human and workers' rights. We are talking about equality and non-discrimination based on sex or religion or political opinion or national extraction, etc. Decent work also means adequate wages and equal pay for work of equal value. Protection from violence and harassment, occupational safety and health, which is even more important at the current times, and social protection, including maternity protection, and also rights to organize and representation and voice. Okay, next slide. So in terms of advocating to invest more in the care economy, I would like to share that there is a global commitment and international standards that recognize the importance of investing in the care economy. For example, Goal 5 on gender equality. So there is the 2030 Sustainable Development Agenda. There is a typo, sorry. And they have many goals, and one goal is on gender equality and another goal is on decent work and economic growth. Basically, countries, they made a commitment to achieve sustainable development goals by 2030. So you can really hold the government accountable by requesting information on progress made on these goals. And under each goal, there are different targets. So you can also request information and really use this information to hold the government accountable for delivering results towards the achievement of these goals. ILO also has a number of conventions and recommendations that promotes decent work for workers in the care economy. So you can also refer to these conventions. Some conventions are specific to certain workers, like Nursing Personnel Convention, Domestic Workers Convention, and then countries are encouraged to ratify and promote the application of these conventions to promote decent work for workers in the care economy. Next slide, please. So the report kind of concludes with a framework that guides stakeholders to promote care work with gender equality, better future with decent work for care workers. So main policy areas include care policies, macroeconomic policies, social protection policies, labor policies, and migration policies. Care policy is very important. I think many countries have policies related to, for example, early childhood care and development. But I think these policies often lack the perspectives of promoting the workers' rights, and then it tends to also focus on the well-being of children. So it is important to look at the benefits for the beneficiaries of these policies, but also providers, workers who are providing those services. Their work needs to be decent work. I also would like to pay attention to migration policies. I think care workers, a lot of them are also migrant workers, and they also face sometimes harsher conditions because they may have limited access to services or organizations that can provide support, and limited access to social protection, etc. And they face also more maybe discrimination as coming from different countries or different race, etc. So migration policies also need to ensure that these migrant workers who are working in the care sector have access to decent work, protected from discrimination or violence and harassment. In terms of policy recommendations, basically we need to recognize reduce and distribute unpaid care work. We also need to reward more and decent work for care workers. And we need to promote representation, social dialogue, and collective bargaining for care workers. And it also provides areas for policy measures. I think for this group, it is very good that you come together to build alliance, because this is really the necessary step to raise voice and give more visibility to the issue. So I hope this can be continued. And I hope, I also would like to share that it's important to support the efforts of formalizing the informal economy, kind of through organizing and advocating. Many of the workers in the care economy are also working in the informal economy, especially in South Asia. So I think Sister Anne shared examples of how they organized and advocated for them to be recognized as workers. There are many evidence that show that once people are organized, they're able to access better protection. So this needs to be continued, and also this support needs to be extended to workers in the informal economy. Just to give an example for India, for example, child care workers under the National Creche Scheme, they only receive 3,500 rupees per month for working full time. 3,500 rupees is about $50. They work as childcare workers, so very important occupation to support the well-being of children. But then they're not organized yet, and attention of the stakeholders and government to ensure their well-being is very limited. Whereas Angandwadi workers who also work in the sector of childcare and ensuring the well-being of the mother who delivered children, they're also not recognized as workers, but because they are organized, they're able to increase their wage close to minimum wage level. So I hope this kind of information sharing and also building alliance can continue to bring more visibility to care work. And from ILO, we are also working to promote decent work for care workers. So we would like to continue to increase visibility by carrying out research, carrying out social dialogue, supporting social dialogue to make progress to improve working conditions for workers in the care economy. Thank you very much.
Thank you so much for that very informative presentation, Sister Aya. I and our union person do agree that it's very important that the government is developing a public employment program, and that we are investing that program development to our public services, especially now that unemployment all over the world is rising, and many of the affected and most vulnerable sectors have a great impact to women and to our economy as well. So we will took note of all the recommendations that you've presented in our study in putting forward and advancing our campaign, because it's not the government alone who will push this, but it is the unions as the workers. So thank you so much for that. And I've seen different sharings happening in our chat box, and I think it's a very good way in maximizing our time. Sister Anne of the ITUC AP actually ask Sister Mariana, for example, that what are your personal tips in helping colleagues they'll cope with pressures at work? And actually, Sister Marian already responded in the chat box that it is by talking to each other, ringing and checking on everyone, the family, friends, and work colleagues, keeping informed about COVID, and good quality time at home with supportive husband, the partner, and doing things at home, relaxing. So it will keep our sanity. So thank you for that question, Sister Anna, and thank you for the response, Sister Marian. But for us to continue, we have here your stories. We have here the workers' testimony in the different care industry, and we have here the study presented by Sister Aya. But I think it's very important that the people who are watching right now and who are in this forum will also hear that from the workers, what will be your dream, your aspiration, especially in this pandemic that we are all facing, and we are sacrificing a lot, but we are not giving up, and we continue our life and the passion that we are investing to care for people. So the last question for our forum, for our panelists, would be, if you have a magic wand, what is the one change that you would like to see happen now, and why? So let's start off with Sister Emma.
If I were to have a magic wand, I would no longer have to choose between going home on time and spending extra time with a palliative patient and their family. Yet this is the sort of decision that we're forced to make. And we're forced to make this decision because we don't have enough time in our shift to go above and beyond. So we do it off the clock. Every single time I would choose to stay back. I would choose to hold the hand of a dying patient. I would choose to comfort a grieving family for as long as they need. And I would do this because this is our job, because this is what it means to be a nurse, and because this is what it means to care. But most alarmingly, we do it because if it's not us, then who? It won't be the next nurse on shift because she's just as busy, she has just as much paperwork as you did, and she's looking after the same amount of people as you. We often have more than one palliative patient at a time, and then we also have our other 30, 40, 50, sometimes 60 residents to care for. Can you imagine providing safe and holistic care to that many people? Can you imagine blaming yourself for not being able to equally accommodate the needs, the complaints, the wishes, and the rights of that many people? Can you imagine what it feels like to wake up in the middle of the night because you have remembered that you didn't help this resident look for their favorite pants like you promised? Or because you've just remembered that you didn't say goodbye to a resident who asked you to before you go on days off? Can you imagine the constant emotional stress? And can you imagine that our government has the power to stop it all? So if I had a magic wand, I would have to imagine, because it wouldn't be my reality, because we would have enough staff to provide safe and holistic care to all of our residents. My magic wand would extend, and I would also have aged care recognized as the specialty area that it is. We would have the staff that the specialty area requires, and we'd also have a diverse staff mix like a specialty area requires. In my opinion, this change would be characterized by legislated staffing minimums, a diverse skill mix in the workplace, and better access to appropriate equipment and education. The need for this is pertinent to the well-being of both our residents and our staff. For staff, this change would mean no more missed toilet breaks, no more missed meal breaks, no more unpaid overtime, no more crying after work because you feel like you haven't done enough, no more guilt because you feel like you didn't spend enough time with everyone, and no more feeling inadequate because no matter how hard you work, there is never enough time. For residents, this change would mean no more compromising their needs and wants because they know that we're too busy, because they don't want to inconvenience us. No more sitting in pain because they don't want to disturb busy staff, and no more apologizing for wasting our time. And no more feeling like we're always rushing them, and no more feeling like they aren't our priority. This is the urgent change that we need, and it's abundantly clear now more than ever. And it's for our government to listen to the reasoning, listen to the stories, and listen to the facts. Thank you.
Thank you so much, Sister Emma. Very well said. Holistic care for everyone, not just for the patients alone affected by the COVID-19, but also to the healthcare workers, to the care workers who are taking care and sacrificing a lot to take care of other people. And for us to continue, Sister Ina.
Okay. Uh, uh, how can we serve our patients while raising our own health? The same concern can be said about other fields of life. For teachers at school, workers at public office, corporation, and etc. and so on. And to me, all people, not only experts from different fields of studies and professions, but also common people, should come together to share ideas in order to propose a better life system. Let us say that to propose a better health care system for a hospital, we need to listen to doctors, nurses, office workers, and also patients and their families. Uh,
That's all.
yeah, that's all. I think, yeah, thank you.
Thank you so much, Sister Ina, for stressing that we all need a better healthcare system, and for us to happen, the government should listen to us. And Brother Francis, I know you have shared your aspiration, but maybe you have some additional inputs in relation to the things that you want to see change.
As I've said earlier, if I have a magic wand, I wish this COVID-19 pandemic will totally disappear in the whole world. And also, with or without COVID, I wish the government uh, will truly value the healthcare workers, and uh, not just by words or praise, but in meaningful law or act for all healthcare workers, public and private. And and lastly, maybe the government can allocate more funds to healthcare system so that they can provide good services to the public and also the healthcare workers.
Thank you so
Thank you.
much for sharing your aspiration, Brother Francis, and for highlighting that we just don't need praises. We need meaningful laws and additional funds in our public healthcare system and public services in general. Thank you so much. So now let's hear Sister Marian. Yeah, Sister Marian, you can unmute yourself. Thank you.
Sorry. My magic wish would be for residential aged care and community care to receive adequate funding, to receive a lot more funding than they do now. Our public sector gets a lot more funding than our private sector, and we need to get the government funding so that the facilities have the money to spend. And we also need compulsory regulations that facilities and companies have to abide by. I hear Sister Emma about staffing. You know, we don't have staffing regulations that are compulsory in New Zealand, except for very minimal requirements for residents that are subsidised. And that's only for subsidised residents, not for paying residents. So, and it's really, really minimal. So it's up to the nurses and the management to decide on how many staff there are on duty, and how does an auditor audit that, you know, going forward. But funding affects everything. It affects staffing, staff training, staff pay, attracting new staff, and staff retention, having all the equipment that you need for your job, and equipment being well maintained, the maintenance and the running costs of a facility, having adequate PPE gear for situations like COVID, and the residents getting a good balanced diet and fluids, and good working conditions for workers, and good quality care for the residents. In New Zealand, our domestic staff earn a little above minimum wage. You know, it's hardly enough to live on. That's why they have to work so many hours. And it also affects people not getting regular shifts. You know, people need decent work where they have regular hours so that they can rely on their money. Workers also need to be around the table a lot more in decision-making processes, so that they can talk about what it's like working on the coalface at grassroots level, because decisions are being made that affect their working conditions and their safety without their input. Staff don't have enough time to do everything they need to do, and so they feel like when they say they're short-staffed to management or anything, they're absolutely sick of being told that you don't have good time management, that you need to manage your time better. You know, it's like you can only do so much in the time you've got. And you can't predict what residents are going to vomit, urinate, or anything, and manage your time better. You just can't predict that. So it's impossible to do. And you can't tell when a resident's going to get angry with another resident, and you have to sort it out and everything else. And because we don't have the staffing regulations, it puts staff under a lot more pressure, because we don't have the staff to cope with everything. We need to care more for our elderly and our disabled community by investing more in their care and investing in the people that care for them. We need to show respect and value the workers and the residents. We can all work together to achieve this. We have had wins before, and we just need to keep pushing for what we need together. Thank you.
Thank you so much, Sister Marian. Keep pushing on what we need. She stressed the need for adequate funding for many different levels of training, proper equipments, and adequate equipments for all care workers. She also stressed that good balanced life for all the care workers, and that would mean good working conditions and really decent work for all. And if that is decent work, then workers are part of the decision making processes of different policies from the company level up to the national workers. And lastly, she highlighted that we should care more for our elderly and other vulnerable communities. But nothing is impossible, because if we can work together and fight for it, we can get our demands together as well. So thank you so much, Sister Marian. And for us to hear the representative of our domestic workers union, the voice of our domestic worker, let's hear what will be the aspiration of Sister Anne Joseph.
I want to change to many things, but it is only one change means then I would wish for comprehensive legislation for domestic workers, not only in our country, but to all the countries. And the ratification of ILO C-189. That is yours. Domestic workers should be recognized as a worker and given labor rights and social protection. 10,000 should be given to all the unorganized workers until the pandemic situation is changed. There should be alternative employment opportunities. Loans should be made available to all the livelihood option, comprehensive legislation for domestic workers with registration to all the workers in the labor welfare board and finance for welfare. ESI, pension, housing, transportation for urgently needed. Education to all the children to be ensured. SDG goal should be implemented. I thank ITUC and CFTUI for giving me this opportunity, and thank you.
Thank you so much, Sister Anne, and thank you, Sister Maria, for sharing the presentation of Sister Anne. Indeed, it's very important, not just in India, but in any other countries who haven't ratified the ILO Convention 189 that recognizes that domestic work is work. And we just don't need ratification. We also need national laws in recognizing that domestic work is work, because like what we reiterated a while ago, most of the women are in the care economy, but most of the work of the women in the care economy, like domestic workers, are undervalued. But it's so hard that we are producing great goods and stuff without the reproductive work of the women and of the men. So we should give value into it. So thank you so much, Sister Anna, for this, and thank you for all the panelists who have shared their great stories and contribution despite of all the challenges that we are facing. I see the light of hope, and I think the spirit of solidarity and our in advancing unionism all over the country is very important, especially right now that we are all in this together. And we should not forget that we are fighting systems of inequality, like the capitalism and patriarchy that produces this kind of situations that we are facing right now. And of course, for sure, many of our guests here and our Zoom room and maybe in our Facebook page have many reflections and questions and insights to our panelists. So are there someone who really would like to ask the member of the panel this afternoon? Though most of you have written all your thoughts and reflections in the chat box, which is very, very good. And everyone is thanking everyone for all the inspiring stories that you have shared. So one question shared by Aya is that in Australia, is there a standard, this is for Sister Aya uh, from one of the participants. In Australia, is there a standard related to care worker age residence ratio? Example, how many care workers should be available, or the minimum for how many residents? Maybe Sister Aya or Sister Emma can answer this. Sister Emma first.
Hi, sorry, I've just submitted my answer in the chat, but I'll just reiterate. As of recent times only, 2 of our states in Australia have introduced staff to resident ratios. However, this is only applicable to our public aged care facilities. And I think it's important to note that the public facilities actually make up quite a small majority of most facilities. So for example, there's a lot that actually aren't mandated by ratios, which is why we're currently still working really hard to try and get ratios everywhere throughout Australia.
Yeah. Thank you, Sister Emma. Sister Aya, would you like to add something?
No, it was the question raised by me, so I would like to thank Emma for her
I see.
response.
Sorry.
Thank you.
Yeah. Thank you, Sister Aya. And I think one of the question of Sister Anna during the chat box was answered by Sister Marian. But we have still 12 minutes. But I think most of you have shared that you're facing mental health difficulties and different kind of level of stresses, maybe you should have respond to this. How do you really cope in this pressures, because it's mentally and emotionally draining. It's like there's a culture of fear. That's why some of our workers are resigning. Maybe that would be the last question, or last message of hope to everyone who's in here. Sister Ina.
Uh, Sister Nice, please repeat the question.
Yes. So a while ago, Sister Anna actually asked Sister Marian, how do you keep yourself moving despite of the pressures and the anxieties you feel when you are in the workplace or at home?
Okay, stay healthy, be aware, and take care. I think that is my. Okay.
Yeah. Thank you, Sister Ina. Very straight forward. And I think it's very important reminder to everyone, especially that we are fighting and advancing the rights of all the working people of the
Okay.
world. Brother Francis, just let me know if you have respond to that. Maybe I'll ask Sister Emma first.
Definitely say just taking a moment to realize that it's okay to have that stress. I think a lot of us focus so much on caring for everyone else that we forget that we need that same care. I think it's taken a lot for me personally to realize that it's okay to realize you're not coping, and to rely heavily on like friends and families and even colleagues as well, I think, because we're all in the same situation. So it's nice to be able to talk about your struggles, because at the end of the day, we're all going through the same thing. And it's nice because you might even help someone else just by sharing, you know, how you're feeling or what you're going through. So just surround yourself with positive people.
Yeah. Thank you, Sister Emma. Sister Anne, how do you cope with the stresses? Maybe as a union leader as well, because I think we are not just stressed by facing the challenges in the workplace, but also the demands of the work of to our union. Yeah, Sister Anne, would you like to respond to that?
Being solidarity with others, we create awareness in the areas to be together in this pandemic time and share to one another and help each other to go through their problems and face it and have courage to be to face your problems in lifetime.
Thank you, Sister Anne. And I think Sister Maria Anna have written her answer, but maybe you can share it to us, Sister.
Yeah, I was just saying what keeps me going is my love of caring for the elderly, really. And that keeps me really focused. And there is a lot of rewards working in aged care. If you've got a love of caring for the elderly, there's a lot of rewards, but it's got to be something that you're passionate about and that you really love doing.
Yes, thank you so much, Sister Marian. Maybe Sister Aya, you have also your concluding remarks before we will come to an end for this forum.
No, I would like to really thank you, all the panelists, for sharing very um, personal stories. That was really moving. And it was also personally really a motivating factor for me to, work more on the care work, which I'm working on right now. But the importance, based on this personal story, gets enhanced. So I would like to thank all panelists for, making the world a better place through care, and also for joining this forum or trade unions to make alliance and bringing issues and sharing and supporting each other. And yeah, I hope to be in touch. Thank you very much.
Thank you so much, Sister Aya. You're right. I cannot imagine a world without care. And by everyone in here, all the panelists and all the workers they represent in our fora today, we would like to say thank you so much. And by fighting this side by side, nothing is impossible. Even though we are battling against a big enemy, because like what I've said and reiterated a while ago, we are battling against systems, but only the working class can free ourselves in this situation. So we will keep pushing and working hard, educating our members that it's very important to rise up and fight back. And we need to regain the importance of public services in all other countries in the world, because that's the most sustainable work. And it's about time that we invest in care. And we would like to thank everyone who joined us today via Facebook page and in our forum. Even though we have a different time zone, you manage to hear the stories of our workers who have sacrificed a lot. Of course, we are all sacrificing because we put our passion to this union work. And that's what it is to be part of the union, continue fighting and struggling for social transformation. And hopefully tomorrow, if you are free, you could also join us again to another batch of forum in the continuing campaign for invest in care. And hopefully we can see each other, maybe not physically, but by social media, through our different efforts in and campaign in the Global Day of Action, October 29. Invest in care. Maybe our action in different forms, but we continue the solidarity. And long live solidarity. Healthcare workers of the world, unite. And to all the care workers and to all the unionists who are still advancing the interest of the working people. Long live to everyone, solidarity, and thank you so much. Thank you so much for all your contributions. And I hope we can document our stories, because it's very important that our stories will be part of the history and her story of the labor movement and of the world. Thank you, and stay safe, everyone. Stay negative to COVID, but stay positive in life and in our movement.
Thank you.
Thank you.
Thank you, everyone.
Congratulations. We keep on fighting and moving and organizing and educating as well. Thank you so much, Sister Anne, Sister
Thank
Ina,
you.
Sister Emma, Sister Marian, and to Brother Francis as well, and to Sister Aya, who's with us. And thank you to the International Trade Union Confederation for bringing us all together in this forum. Thank you to our interpreters. Thank you so much.